Hi, my name is Alina and I am a recovery room nurse here at the Spring Hill Medical Center. Basically, I work in the post-anesthesia care unit, commonly known as the recovery room. And in here we see a broad spectrum of patients, from babies to adults. We receive patients from surgery, from the GI lab, from radiology, and other departments. Basically, this is where patients come to be stabilized before they go home or back to their room in the hospital. There are times when we see patients before they go to surgery, and that is called the preoperative area. These are for patients that are in-house patients that come to us before going to surgery, and when we receive them, we have to make sure that the consents are signed. We have the right patient by a two-patient identifier by the name and date of birth. We have to assess the health of the patient, labs, radiology, any type of results that we need for the particular surgery. Once I receive a patient from the OR, I receive a report from the circulator and I hook the patient up to the monitor so that we may monitor the vital signs, and we do this every 15 minutes. We also make sure that we give them oxygen. We make sure that they have stability in the respiratory area. I manage the pain because we know that this is very important for the patient to be able to get back to activities of daily living. They need to turn, cough, and deep breathe, and this is very difficult if they're in pain. So my goal is to make the patient comfortable and get them back to their normal limits. Depending on the type of patient that I receive, I may have to draw labs. I may have to initiate IV fluids. Also, if it's an in-house patient, all in-house patients get the compression hose, which prevents clots. And then also, because of pain management, I may have to initiate PCA pumps, commonly known as a patient-controlled analgesic pump. In between seeing my patients, I also sit down at the computer in order to chart on each individual patient. I enter information on each patient, which includes vital signs, a complete assessment, and then every 15 minutes I chart the vital signs as well as an assessment of pain for each patient. Typically, I work an 8-hour shift or a 12-hour shift. At times it can be stressful, especially when I receive two patients out of surgery at the same time. It becomes more challenging for me to provide for both patients the things that they need. If you're interested in becoming a nurse in a recovery room, first you would have to go to school to become a nurse. You can do this by attending a junior college for a 2-year degree, or you can go to a university for a 4-year bachelor's degree. Before becoming a nurse, everyone must pass the NCLEX exam, which qualifies you to become a nurse. Also, to work in recovery, you must have certain certifications. One is called the ACLS, which is Advanced Cardio Life Support Certification, and also now nurses must be PALS certified, which is a Pediatric Advanced Life Support Certification. And everyone must have BLS certification, which is Basic Life Support. Other qualifications needed for working in a recovery room is good communication skills, good customer service, a person who is compassionate and able to deal with patients who are in pain, because everybody is in pain. The best part of working in the recovery room for me is that it's constantly changing. The patients are constantly changing. So I get to see the patients maybe a couple of hours and they're gone home or gone to the room. Other nurses may enjoy working with the same patient on a day-to-day basis until they are discharged from the hospital. For me, there is not a worse part to this job. However, there are some nurses who prefer not to work here because they do not want to manage ventilators, or since we're not a 24-hour unit, we also must take call. and therefore we have to come in sometimes in the middle of the night for emergency surgeries. Sometimes we're here overnight after working a 12-hour shift. So for some, that would be the worst thing for working in the recovery room. No matter what unit you're working on in a hospital, you will have to deal with blood and body fluids on a day-to-day basis. If you're in high school and you're considering nursing as a profession, I would advise you to take as many sciences as you can, chemistry and biology in particular, and also concentrate on math. And once you've entered into a college, nursing can be very challenging at times. My advice to you is not to give up, to continue to work hard because the reward is great. Also, you can do volunteer service in a hospital so that you may have contact with people who are in that line of work.